Good morning, Miller Roseberg. I am Mihiraa. Let's start the warm-up sessions. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. You can now start the roleplay.
Good morning, Mihiraa. I can see you might be feeling a little concerned today. Please don't worry, we're here to go through everything step by step. My name is Miller Roseberg, and I'm one of the nurses here at the Community Health Center. Today, we're going to talk about your recent diagnosis of vitamin B12 deficiency. We'll review how you've been feeling, check your understanding of the condition, and discuss ways we can manage it moving forward. We'll take it one step at a time. To start with, can you tell me a bit about how you've been feeling lately?
Yes, I have been feeling extremely tired for the last few months, and sometimes I get this strange tingling in my hands and feet. I thought it was just because of getting older or working too much.
Thank you for sharing that with me, Mihiraa. It's completely understandable to think that way, but I'm glad you brought it up so we can look at it properly. Those symptoms you're describing, fatigue and tingling, are actually quite typical in vitamin B12 deficiency. It's good that we caught this now, so we can help you feel better soon. Before we dive deeper, I'd like to check what you already know about vitamin B12 deficiency.
Not really. The doctor just told me my blood test showed low B12 and that I would need treatment. I don't know much more than that.
That's absolutely fine, Mihiraa. Mihiraa, let me explain a little more about why vitamin B12 is so important for your body. I want you to feel fully informed, and please know you can ask me anything along the way. Vitamin B12 plays a key role in keeping your nerves healthy. It protects the covering around your nerves, almost like the insulation around electrical wires, so they can send messages properly throughout your body. It's also vital for making red blood cells, which are responsible for carrying oxygen to all your tissues and organs. Without enough B12, your body can struggle to produce healthy red blood cells, leading to a condition called anemia, which can leave you feeling extremely tired, weak, and sometimes short of breath. If vitamin B12 levels stay low for a long time, it can also affect the nervous system. That's why some people experience tingling or numbness in their hands and feet, balance problems, memory issues, or mood changes. But please remember, catching it early, like we have in your case, gives us a great chance to prevent these problems from getting worse. As for what causes vitamin B12 deficiency, there are a few possibilities. Sometimes it's due to not getting enough B12 in your diet, especially if someone eats little or no meat, dairy, or eggs. Other times, the problem isn't what you eat, but how your body absorbs the vitamin. Conditions like pernicious anemia, where the immune system attacks the stomach lining, or atrophic gastritis, which causes the stomach lining to thin, can make it hard for your body to absorb B12 properly. Surgery that affects parts of the stomach or intestines can also have an impact, even if the surgery was many years ago. Hearing all of this can feel like a lot, but you're not alone in managing it. We'll take this step by step together.
Now that you mention it, I did have surgery for a stomach ulcer about 10 years ago. I didn't realize that could affect my vitamins.
Thank you for sharing that, Mihiraa. Yes, past stomach surgery can sometimes interfere with how your body absorbs vitamin B12. But the good news is, we have effective treatments. You'll most likely start with vitamin B12 injections to quickly bring your levels back up. After that, depending on how you respond, we might switch to oral supplements that you can take at home. We'll also look at making small changes to your diet if needed, adding more foods rich in vitamin B12. And importantly, we'll check if there's anything else, like your stomach health, that needs ongoing attention. I want to make sure all your questions are answered. What concerns do you have so far about the treatment or anything else?
I'm a bit nervous about injections. Are these treatment options sufficient?
That's a very understandable concern, Mihiraa. I want you to feel reassured, vitamin B12 deficiency is very manageable once we start treatment. The prognosis is generally very good, especially because we've identified it early. With the right care, many people feel much better within just a few weeks. We'll begin your treatment soon, and I'll be closely monitoring your progress. You won't be doing this alone. We'll check your blood levels regularly to make sure everything is moving in the right direction. Long term, some people need ongoing supplements or occasional injections, but the important thing is that we'll adjust everything based on how your body responds. To make sure you're improving as expected, let's schedule a follow-up appointment in 3 weeks. At that visit, we'll review your symptoms, repeat any necessary blood tests, and make any changes to the plan if needed. Does that sound alright to you, Mihiraa?
Yes, that sounds good. Thank you for explaining everything so clearly. I feel a lot better now.
You're very welcome, Mihiraa. I'm glad to hear that. We'll take good care of you every step of the way. See you again in 3 weeks.